course, the fight over the Affordable Care Act, more commonly called Obamacare, has been at the center of the budget battle that led to the partial government shutdown.
And today, a key provision of the controversial health care overhaul took effect. It's the first day uninsured or self-insured Americans can begin enrolling for coverage through online marketplaces like HealthSource RI to make sure they're covered when insurance becomes mandatory on January 1st.
Eyewitness News reporter Susan Hogan joins us now with more details on the new health exchange, how it works, and what it means for you.
Well, as expected, things got off to a rocky start. Close to 4,000 people tried logging on to the system all at once as soon as it went online, causing delays. But as of right now, it is up and running. But just how many people have enrolled? Those numbers aren't in yet.
Sandy Calcagni and her husband decided to come in person, bypassing HealthSource Rhode Island's website, where more than 100,000 page views have already caused the system to experience a few delays. Sandy is on COBRA and says she's paying through the nose and is looking for cheaper health care and hopes to find it.
What do you think you can afford, and what are you expecting from this experience?
Oh, I'm expecting a somewhat cheaper.
What are you paying right now, Sandy?
$827 a month.
Today, Rhode Island dignitaries toured the contact center where callers have been flooding the phones with questions. If you are one of the 124,000 Rhode Islanders who don't have health insurance or are self-insured, you can visit healthsourceri.com. You plug in your income, age, and list of dependents if you have them, and a list of what's being offered appears. From here, you shop around. For example, a person with a $35,000 income, age 38, with no dependents has several health insurance options available. However, as you can see, they're not cheap.
There's no question that that for some people it's not going to be affordable. And for those people who can't afford it this year, we're going to do our very best to make sure that they can afford it next year.
The state is being realistic, acknowledging not everyone who needs health insurance will sign up. And the penalty for not, $95 a year.
There's nobody that I know who thinks that that penalty is what's going to motivate people to have health insurance. Our job is not today. Our job is what happens after today.
Now, the state says they were so far thrilled with the volume and the demand on the website. It's exceeding their expectations, but what that means in terms of enrollment, they don't have the numbers, as I said, just yet. I'm Susan Hogan, Eyewitness News.